Welcome everyone to the learning module of a brand that is a key to lock the blood loss, that is Tranlock. It is rightfully said that blood is the essence of life. Due to many reasons, blood loss can happen and sometimes it can be life-threatening if not treated in time. Some of the reasons for blood loss, that is hemorrhage, are common reasons: hemophilia, that is deficiency of clotting factors, surgical procedures, some invasive surgical procedure which lead to blood loss, trauma, GI bleeding, epistaxis, that is nose bleeding, can also lead to hemorrhage. In females, menstrual bleeding is very common, uterine fibroids, and even postpartum hemorrhage, that is the blood loss after the delivery of a newborn, can lead to a blood loss. In the previous slides, we have seen hemorrhage means blood loss. In this slide, there is a new term, that is hemostasis. Hemostasis means stoppage of bleeding. Normally, blood remains in liquid form within the blood vessels. When blood vessel is damaged, clot is formed which stops the blood loss. Now this hemostasis can happen in three mechanisms. First is vascular spasm, that is smooth muscles in the artery wall, they contract and result into spasm, in turn reducing the blood loss. Second is platelet plug formation. Third is clot formation, that is there are various clotting factors along with fibrin which are involved which results in clot. So these three mechanisms combined results in hemostasis. We are going to learn more about platelet plug formation and clot formation. Coming to clot formation, clot is a complex cascade of reaction in which clotting factors are involved. For us, the important thing is to understand how the clot is formed. If you look at the diagram on right side, there is a damaged blood vessels which activates blood components which results in formation of prothrombin. Prothrombin then gets converted to thrombin with help of calcium. Thrombin gets converted into fibrinogen. Fibrinogen gets converted to fibrin thread which leads to platelet plug. In addition to vasoconstriction, this platelet plug forms into blood clot. To understand this concept, let's have a look at this clip. For example, let's consider there is a cut on our fingertip and blood starts to come out. Our body has a self-healing mechanism in which RBCs, platelets, fibrin, and clotting factor, they come together to form a clot. This fibrin mesh is very important because it holds this clot together. Now, after a week, consider the wound is healed. Once the wound is healed, this clot has to be dissolved. And for dissolving this clot, we need to dissolve the fibrin mesh. And this process of dissolving fibrin mesh is called as fibrinolysis. So yes, the process of breaking of fibrin meshwork once injured tissue is repaired is called as fibrinolysis. In fibrinolysis, there is tissue plasminogen activator which is involved, that is TPA. Now this TPA is very important because once TPA gets activated, it dissolves the fibrin clot. Plasmin is responsible for digesting the fibrin thread. So this process of formation of clot and breaking down of clot is very common. It happens in day-to-day life. So there is a balance which is maintained between formation, that is coagulation cascade, and fibrinolytic system. So what if there is an imbalance which occurs? That is, the clot is not getting formed and the fibrinolysis also takes place. So this process will lead to excessive bleeding, and hence this is where our antifibrinolytics comes, because antifibrinolytics, they act on this fibrin mesh and they stop the bleeding. We have three products, that is tranexamic acid, which is our brand Tranlock. We have ESCA and aprotinin, which are antifibrinolytic drugs. So Tranlock is, yes, antifibrinolytic agent. Tranexamic acid is a synthetic derivative of amino acid lysine. The composition of Tranlock tablet is, it contains tranexamic acid 500 milligram, and we also have injection which contains 500 milligram. So in previous slides, we have seen the process of fibrinolysis in which TPA is involved. TPA activates plasminogen and it breaks down the fibrin meshwork. That is that is normal. Okay, but what happens if we don't want to dissolve the clot? So we need a tranexamic acid. We need antifibrinolytic agent which will stop the binding of plasminogen to fibrin. So in the figure on the right side, you can see that this black box, that is tranexamic acid, it binds to plasmin and hence plasmin cannot bind to fibrin. And due to this reason, the clot is not dissolved. The fibrin mesh is not dissolved. The mechanism of action of tranexamic acid and how it stops the blood loss. The next question that arises is, which specialty do prescribe this tranexamic acid and in which indication? So yes, it is prescribed majorly to females in bleeding conditions by gynecologists. So gynecologists, they do prescribe in dysfunctional uterine bleeding, menorrhagia, postpartum hemorrhage, cesarean section, and by surgical doctors or gynaes who perform surgery in indications such as hysterectomy, mammectomy, GI surgeries, and trauma. We will understand each one of them. Let's have a look. The first indication is dysfunctional uterine bleeding. It is the most common type of abnormal uterine bleeding. It is heavy or irregular menstrual bleeding and it is mainly caused because of low progesterone levels. The second indication where tranexamic acid is prescribed is menorrhagia. It is excessive or prolonged menstrual bleeding of more than 80 ml. Menorrhagia results in weakness, physical and mental trauma, and inconvenience. Gynecological indications where it is prescribed is postpartum hemorrhage and cesarean section. PPH is often defined as loss of more than 500 ml of blood within the first 24 hours of childbirth. The common cause of PPH is poor contraction of uterus or a tear of uterus or poor blood clotting. Caesarean section is a surgical procedure where baby is delivered by performing a surgery, and it is a big surgery, therefore there is a lot of loss of blood. Coming to dosage and administration, Tranlock tablet is prescribed as one tablet of 500 mg 3 to 4 times a day for 3 to 4 days during that menstrual period. Tranlock injection is given as 10 to 15 mg per kg 3 times daily as an intravenous injection or as a continuous infusion at the rate of 25 to 50 mg per kg daily. Coming to our second product, that is Tranlock M. It is a fixed dose combination of tranexamic acid and mefenamic acid. Tranexamic acid is an antifibrinolytic agent, whereas mefenamic acid is a non-steroidal anti-inflammatory drug. Composition of Tranlock M is, it contains tranexamic acid 500 mg and mefenamic acid 250 mg. Coming to mechanism of action, as we have seen the mechanism of Tranlock, that is plain tranexamic acid, it inhibits plasminogen binding to fibrin and it prevents the clot lysis, that is breaking down of clot, and therefore it reduces the blood loss. Whereas mefenamic acid is an anti-inflammatory and analgesic agent. So what mefenamic does is it reduces the pain. So a lot of times menorrhagia is associated with pain, and therefore a combination of tranexamic acid and mefenamic acid is usually given in painful menses. So the indication of Tranlock M is it reduces excessive menstrual bleeding. It is used to treat menstrual pain, that is dysmenorrhea. It also decreases uterine cramps. Dosage, it is 1 tablet 3 to 4 times a day for 4 to 5 days during that menstrual period, and it is available as tablet strips of 10. We have seen three products before, that is plain Tranlock, tranexamic acid tablet, we have seen tranexamic acid injection, and we have seen Tranlock M. Coming to our fourth product, that is Tranlock E. It is a fixed dose combination of two hemostatic agents, that is tranexamic acid and etamsilate. It is specially developed for heavy menstrual bleeding, and tranexamic acid, as you know, it prevents lysis of clot. Coming to mechanism of action of etamsilate, it improves platelet adhesiveness, it restores capillary resistance, it increases platelet plug formation, and it prevents damage to endothelium, therefore reducing the bleeding from small blood vessels and maintaining capillary integrity. Tranlock E dosage is 1 tablet 3 to 4 times a day. Indication is heavy menstrual bleeding. That is, whenever a plain tranexamic acid tablet, that is Tranlock tablet, is not enough, ask your doctor to prescribe Tranlock E because it has two hemostatic agents and it comes in a strip of 10 tablets. Coming to the summary, for the effective management of blood loss, we have four products. First is Tranlock. It is given in dysfunctional uterine bleeding. The dosage is 1 tablet 3 times daily for 3 to 4 days. The second product that we have is Tranlock M, which is in menorrhagia associated with pain, and the dosage is 1 tablet 3 times a day for 4 to 5 days. For Tranlock E, again it is for heavy menstrual bleeding, and the dosage is 1 tablet 3 times a day for 3 to 4 days. And for Tranlock injection, it is prescribed in postpartum hemorrhage and gynec surgeries, and the dosage is 10 mg per kg body weight 3 to 4 times daily. Coming to our visual aids, first at gynec. Doctor, abnormal uterine bleeding can lead to heavy and prolonged menstrual cycle. Doctor, prescribe Tranlock. It contains tranexamic acid 500 mg tablet. Doctor, it locks the blood loss effectively. Doctor, it is recommended by American College of Obs and Gynae for the treatment of acute abnormal uterine bleeding. Doctor, it is the first non-hormonal drug approved by FDA. Doctor, prescribed tranexamic acid as it reduces menstrual blood loss by 34 to 59%. It improves quality of life in AUB patient, and it increases mean serum hemoglobin by 34% after 3 cycles. Doctor, in menorrhagia associated with pain, prescribe Tranlock M. It locks the blood loss, relieves pain as well. Tranlock M contains tranexamic acid 500 mg and mefenamic acid 250 mg. Doctor, tranexamic acid and mefenamic acid combination reduces menstrual blood loss by 40 to 50%, relieves dysmenorrhea in 38.6% patient, and also decreases pain and inflammation. Doctor, this combination is endorsed by RCOG for the management of menorrhagia. Doctor, it can also be prescribed in IUD associated menorrhagia and post gynecological surgeries where there is a lot of pain. Doctor, dosage for this Tranlock M is 1 tablet 3 times a day. Doctor, for dual action in heavy menstrual bleeding and bleeding associated with fibroids, prescribe Tranlock E. It contains tranexamic acid 500 mg and etamsilate 250 mg tablet. It is a dual lock for blood loss. Doctor, the combination therapy is an effective approach to control menstrual bleeding with tranexamic acid and achieve hemostasis with etамсилет. Tranexamic acid and etамсилет combination reduce menstrual blood loss by 50% in patient with menorrhagia, by 19% in patient with IUCD. It is well tolerated and effective in HMB. Doctor, the dosage is one tablet 3 times a day. Doctor, in postpartum hemorrhage after vaginal birth or C-section, prescribe Tranlock injection. It is tranexamic acid 500 mg injection. It locks the blood loss effectively. Doctor, tranexamic acid significantly reduces the risk of death due to bleeding. It reduces PPH-related death by 30%. It reduces urgent need of laparotomy to control bleeding. It is also effective in gynecological and obstetric surgeries. It is recommended by WHO, British Association for Emergency Medicines, and EGA. Doctor, loading dose is 1 gram and then infusion of 1 gram over 8 hours. For hospital surface are as follows. Doctor, uncontrolled massive bleeding is a major challenge in management of both surgical and seriously injured patients. Prescribe Tranlock injection. It contains tranexamic acid 500 milligram injection. It locks the blood loss effectively. Doctor, in trauma, prevent death due to blood loss. Prescribe Tranlock injection. It locks the blood loss effectively. It is recommended by Crash 2 trials, which says that patients who received tranexamic acid had 15% lower chances of dying from hemorrhage. There's BJS journal which says that tranexamic acid reduces blood loss by one-third in surgical patients, and even European guidelines of major trauma 2016 strongly recommend early administration of tranexamic acid in trauma patients. Doctor, the dose for Tranlock injection is 1 gram loading dose over 10 minutes, then infusion of 1 gram over 8 hours. Doctor, in postpartum hemorrhage after vaginal birth or C-section, prescribe Tranlock injection. It locks the blood loss effectively. Tranexamic acid significantly reduces the risk of death due to bleeding. It reduces PPH-related death by 30%. It reduces urgent need of laparotomy to control bleeding. Doctor, it is also effective in gynecological and obstetric surgeries. It is recommended by WHO, European Association of Medical Emergencies, and EGA. Doctor, the dosage for Tranlock injection is 1 gram loading dose over 10 minutes and then an infusion of 1 gram over 8 hours. Visual aid page for general surface. Doctor, in menorrhagia associated with pain, prescribe Tranlock M. It contains tranexamic acid 500 milligram and mefenamic acid 250 milligram tablet. Doctor, it locks the blood loss and relieves pain as well. Doctor, tranexamic acid and mefenamic acid reduce menstrual blood loss by 40 to 50%. It prevents dysmenorrhea in 38.6% patient. It decreases pain and inflammation, and it is endorsed by RCOG for management of menorrhagia. Doctor, it can also be prescribed in IUCD associated menorrhagia and post gynecological surgeries. Doctor, the dosage for Tranlock M is one tablet 3 times a day. Thank you everyone for this session of virtual learning. Stay safe and stay at home.